Picture three people who cannot walk in a straight line. A 74-year-old grandmother leaving her book club, a college student leaving a party, a 14-month-old taking her first real steps across a kitchen floor. All three wobble, all three drift. And if you saw all three, you would draw three completely different conclusions, because the cause in each case is completely different. That distinction is everything, and most doctors are getting it wrong. I have sat across from patients in my clinic who spent 6 months doing leg strengthening exercises, buying calcium supplements, downloading balance apps on their phones, and nothing changed. Not because they weren't trying, because they were treating the wrong organ. If you are drifting when you walk, catching yourself on walls, losing your footing on ground that is perfectly flat and perfectly dry, your legs are not the problem. Your brain is. Specifically, a structure inside your brain called the cerebellum, and more specifically, the blood supply feeding it. That is what we are talking about today. I am Dr. Pablo. I am a board-certified geriatrician with 18 years of clinical experience working with adults over 60, specializing in cardiovascular health and age-related neurological function. And today I'm going to walk you through exactly what is happening inside your body when balance starts to go, why the standard advice almost universally misses the real cause, and what the research actually says you can do about it, starting today, at home, with no equipment. But before we get to the exercises, you need to understand the mechanism. Because if you understand what is actually going wrong, the solution will make complete sense, and you will never waste another month treating the wrong thing. Let me start with something most people have never consciously thought about. Walking is not a stable activity. Walking is controlled falling. That is not a metaphor. That is a precise biomechanical description of what your body does every single time you take a step. You lean forward, your center of mass moves beyond your base of support, and for a fraction of a second you are genuinely falling. And at that exact moment your leg swings forward and catches you. Every step, controlled falling, caught by a leg, timed to the millisecond, and the structure running that timing is the cerebellum. The cerebellum sits at the base of your skull, at the back. In terms of volume, it accounts for roughly 10% of your total brain mass. But here is what most people, including most non-specialist physicians, do not appreciate about it. In terms of raw neuron count, the cerebellum contains more than 50% of all the nerve cells in your entire central nervous system. More than half of your brain's processing units packed into 10% of the space. It is extraordinarily dense computing power, and it is running every single movement you make. Not just walking, but reaching, turning, catching yourself when you trip, adjusting your weight when the ground shifts beneath you. All of it. Every fraction of a second, the cerebellum is pulling in data from 4 sources simultaneously: your muscles, your joints, your inner ear, and your eyes. And it is issuing micro-corrections so fast and so precise that you never consciously notice them. When it runs at full capacity, you walk without thinking. When it starts running on reduced power, you stumble. That is the entire mechanism, and it is critical that you understand this. The cerebellum does not run on reduced power because your legs are weak. It runs on reduced power because its blood supply has been compromised. And in adults over 60, that compromise almost always originates in a place nobody thinks to look: the neck. Now, I want to say something here before we go further, because this is the part where some of you are going to recognize yourselves, and I want you to take that recognition seriously. Patients who come to me with unsteady walking almost never come in saying, "I think I have a blood flow problem in my cerebellum." They come in saying they are clumsy lately. They come in saying they feel off. They come in because their spouse noticed them drifting and got worried. And when I take a full history, almost every single one of them also mentions other symptoms they have never connected to the walking. Short-term memory that has gotten noticeably worse over the past 1 to 2 years. Walking into a room and genuinely not being able to recall within seconds why they went in there. Mental fatigue that hits in the early afternoon like a wall, even after a full night of sleep. A kind of cognitive heaviness my patients describe as thinking through wet concrete. Everything slightly slower, slightly harder to access than it used to be. These are not separate problems. They are the same problem. They are all symptoms of a brain working on a reduced oxygen supply. And that matters enormously, because it means that when we fix the underlying cause, all of those symptoms tend to improve together. Here is the anatomy you need to understand, and I'm going to be specific, because the specifics are what make this make sense. 2 arteries supply blood to the back of your brain. They are called the vertebral arteries. And what makes them anatomically unique, what makes them unlike almost any other major vessel in your body, is that they do not simply run alongside your cervical spine. They run through it. There are small openings in the lateral processes of each cervical vertebra, the side projections of the bones in your neck, and the vertebral arteries travel through those openings, bone by bone, all the way up through the neck. Then they loop around the atlas, that is the very first cervical vertebra, the one your skull rests on, and they enter the brain. Once inside, the two vertebral arteries merge into a single vessel called the basilar artery. And the basilar artery is what feeds the cerebellum, the brainstem, and the posterior regions of the brain responsible for coordination, memory consolidation, and cognitive processing speed. This system is called the vertebro-basilar circulation. And what it means structurally is this. The artery feeding your cerebellum is threaded through your bones. If there is chronic tension in the muscles surrounding those vertebrae, if there is stiffness in the joint capsules, if there is even mild postural compression in that corridor, the artery experiences an additional, persistent narrowing. Not dramatic, not stroke level. Chronic, persistent, over months and years. And that slow, quiet reduction in flow is exactly what produces the wobble, the fog, the fatigue, and the memory gaps. One structural problem, 4 symptoms, one solution. Now I need to tell you about the 2 specific zones in the neck where this compression actually builds, because this is where almost everyone goes wrong, even people who are already trying to stretch and mobilize their neck. When most people feel tension in their neck and decide to do something about it, they tilt their head forward, they pull one ear toward a shoulder, maybe they roll the neck in slow circles. All of that movement happens at the middle of the cervical spine, around the 5th and 6th vertebrae. And here is the problem with that. That segment is already the most mobile part of your neck. It is already doing the most work every single day. Adding more movement there accomplishes very little therapeutically. And done aggressively, it can actually aggravate the structures in that region rather than help them. The real compression builds in 2 completely different locations. The first is at the base of the neck, what anatomists call the cervicothoracic junction, the region where the 6th and 7th cervical vertebrae meet the 1st and 2nd thoracic vertebrae. This is where chronic mechanical restriction accumulates over years of forward head posture, desk work, driving, looking down at screens. You may have noticed a small raised area at the base of the back of your neck. Many people call it a dowager's hump and assume it is a fat deposit. It is not fat. It is a chronic mechanical block, a thickening of the muscle, ligament, and joint capsule tissue at that junction that has been building for years. And it sits directly in the path of the vertebral arteries as they travel upward through the cervical spine. The second zone is at the very top of the neck, the 1st and 2nd cervical vertebrae, right where the spine meets the skull. This is where the vertebral arteries make their final bend before entering the brain. Restriction here affects blood flow at the last possible checkpoint before the blood reaches the cerebellum. 2 zones, both largely ignored by conventional stretching advice, both directly implicated in vertebral basilar circulation compromise. Those are the 2 targets. I want to tell you about a patient of mine before we get into the exercises. A woman named Margaret, 69 years old, retired high school biology teacher, grandmother of 4. She came to see me after her daughter essentially insisted she come. Margaret had been stumbling for about 8 months. Not dramatically, not falling to the floor, but drifting. Catching her shoulder on the doorframe going into the kitchen, veering slightly left in the grocery store aisle, reaching for something on a shelf and having to grab the shelf itself to stay upright. She had been to her primary care physician, who had ordered an MRI of her lumbar spine, her lower back, found mild degenerative changes consistent with her age, and recommended physical therapy focused on core strengthening. She did 12 weeks of it, faithfully, 3 times a week. Her core got stronger. Her walking got no better. When she sat down across from me and I asked her to describe everything she had noticed over the past year, not just the walking, everything, she mentioned almost as an afterthought that she had been unusually tired by 2 in the afternoon, that she had started losing words mid-sentence in a way that embarrassed her in front of her grandchildren, and that she had begun avoiding situations that required her to walk on uneven surfaces, grass, gravel, anything that wasn't flat pavement. She had quietly reorganized her life around the limitation without fully realizing she had done it. When I examined the mobility of her cervicothoracic junction, it was profoundly restricted. Almost no independent rotation at C6, C7, T1. The musculature around her upper cervical spine was in a state of chronic contraction that she described as not painful, just always there, like a permanent low-level tightness she had stopped noticing. We began working on both zones. Within 3 weeks, her daughter called my office to tell me that Margaret had walked to the end of her street and back on the grass verge without holding anyone's arm. That was the moment Margaret told me she felt like herself again. That is what restoring vertebro-basilar circulation looks like in a real person. Not a dramatic overnight reversal, a gradual, measurable, meaningful return. So let us get into exactly what to do. I am going to give you 5 specific interventions, 2 that address the mechanical restriction in the neck, and 3 that directly train the cerebellum itself. Done consistently, this combination is what the research supports and what I have seen work clinically, repeatedly, over 18 years. The first intervention targets the cervicothoracic junction. Locate the 7th cervical vertebra. This is easy to find. Drop your chin slightly toward your chest and run a finger down the back of your neck toward the base. You will feel one spinous process, the bony prominence on the back of each vertebra, that projects noticeably further than the others. That is C7. Anatomists actually named it vertebra prominens, the prominent vertebra, because it is that obvious. Place the pad of one finger on the side of that spinous process. Now begin slowly turning your head to the same side. As your head rotates, apply gentle, consistent pressure with your fingertip, nudging the spinous process in the same direction your head is moving. You are not forcing it. You are assisting it. The ligaments connecting these vertebrae are elastic structures, firm, like a dense rubber band. And what you are looking for is the point where you feel a soft, elastic resistance under your fingertip. That is your endpoint. That light tension is exactly right. Do not push through it. When you return your head to center, keep the finger pressure applied for a moment before releasing. That brief sustained stretch on the joint capsule is where the therapeutic effect is concentrated. After C7, move one vertebra lower to T1 and repeat the same sequence. Then T2. Work gently. This junction accounts for only 5 to 10% of total cervical range of motion, but its influence on vertebral artery flow is disproportionately large. And as a secondary benefit, when this junction frees up, shoulder mobility improves simultaneously, because the cervicothoracic junction connects directly to the shoulder girdle. The second intervention is a targeted stretch for the sternocleidomastoid, a long clinical name for a muscle that runs from just behind your ear all the way down to your collarbone and breastbone. When this muscle stays chronically contracted, it pulls the head forward and compresses the entire cervical corridor. Place one hand flat on your collarbone on one side and press it firmly downward. Now slowly, no jerking, no bouncing. Tilt your head to the opposite side and lift your chin slightly upward. You will feel a clean, deep stretch along the front and side of your neck. That is the sternocleidomastoid releasing. Hold it at the level of comfortable tension, not pain, not sharpness, just a firm, clean pull. Breathe normally throughout. Then shift your angle slightly, chin more toward the ceiling this time, to reach the posterior lateral fibers of the muscle. Switch sides. Finish by placing both hands around the back of your neck, fingertips on either side of the vertebral column, and work the muscle bands on both sides with firm, slow, kneading pressure. This completes the mechanical release and prepares the cerebellum training that follows. Now I want to pause here and say something directly to you, because we are about 7 minutes in, and I want to know who is watching this. Write your age and where in the world you are watching from in the comments below. I read every single one. And if any of what I have described in the last several minutes, the drifting, the afternoon fatigue, the word-finding difficulty, if any of that resonated with you personally, write that too. You are not alone in this, and you are not too far gone to fix it. Not by a long distance. Now, the cerebellum itself. The neck work improves the blood supply. What comes next is direct cerebellar training. And here is something about the cerebellum that the research makes absolutely clear. A landmark 2019 paper published in the journal Neuron demonstrated that the cerebellum retains robust neuroplastic capacity well into advanced age. Neuroplasticity means the brain's ability to reorganize itself, to build new neural connections and strengthen existing ones in direct response to challenge. The cerebellum does not simply deteriorate passively with age and accept its decline. When given consistent, appropriate challenge, it adapts. It increases its own metabolic activity. It builds. The 3 exercises that follow are specifically designed to provide that challenge. The third intervention is what I call multi-rhythm coordination training. Stand with your feet shoulder-width apart on a flat surface. Begin rotating your hips in a slow, smooth circle. Not your shoulders, not your whole torso, just the pelvis, rotating continuously. As you do that, notice what your legs naturally want to do in response. A rotating pelvis initiates a stepping pattern. One leg will want to step forward and sweep outward in rhythm with the movement. Let it follow that impulse. You now have 2 simultaneous movement patterns running, the hip rotation and the stepping. Now add your arms. Begin making alternating drumming motions with both hands, right, left, in their own independent rhythm, not synchronized to your legs or your hips. 3 movement patterns, 3 different rhythms, none of them locked to the others. The first several times you attempt this, the patterns will collide. You will lose the arm rhythm while concentrating on the hips. You will freeze the stepping while trying to coordinate the arms. That collision, that awkwardness, that is not failure. That is the cerebellum working at the absolute edge of its current capacity. That is the training zone. Each session it becomes fractionally smoother. When it eventually feels effortless, and it will, that means new neural pathways have been built and consolidated. You have genuinely upgraded the system. The fourth intervention is spotting turns, a technique used by professional ballet dancers and figure skaters, though most people who watch them have no idea what they are actually observing neurologically. A trained dancer can execute dozens of consecutive rotations and walk off the stage without a single stumble. They are not built differently from you. They were trained differently. Specifically, they were trained to use a technique in which the gaze locks on a fixed point, a spot on the wall, and holds there as long as physically possible, while the body rotates beneath it. Then the head snaps rapidly forward to reacquire that same spot before the next rotation begins. This prevents continuous vestibular overstimulation. The vestibular apparatus, the balance organ inside your inner ear, is protected from the kind of sustained stimulation that produces dizziness, and the brain maintains spatial orientation throughout the turn. To practice this, pick a point on the wall directly in front of you at eye level. Fix your gaze on it. Take 3 steps and execute a full rotation. The moment you complete the turn, find your spot immediately. Build speed across sessions, then reverse direction. A 2021 study in Frontiers in Neurology confirmed that vestibular training of this type, consistent progressive rotational challenge, produces measurable reductions in fall risk in adults over 65 within 8 weeks. 8 weeks. That is how responsive this system is to the right input. The 5th intervention is the one I consider the most powerful single tool in this entire protocol, and it is also the one most people would never think to try. It is called tandem walking with head rotation. Find a clear hallway or open floor space. Place one foot directly in front of the other, heel to toe, and walk in a straight line in that position. That alone is a significant cerebellar challenge for most adults experiencing balance disruption. Now, while maintaining that tandem stance and continuing to walk, slowly rotate your head from side to side, left, right, at a steady pace. Do not stop walking. Do not look down. Keep the gaze level and let the head move independently of the body's forward motion. This exercise is demanding because it forces the cerebellum to process conflicting sensory inputs simultaneously. The inner ear is detecting head rotation, while the eyes are sweeping across a changing visual field, while the proprioceptive system in your feet and ankles is managing a narrow base of support. All 3 sensory streams feeding the cerebellum at once, all requiring integration, all requiring real-time correction. A 2020 study in the Journal of Neuroengineering and Rehabilitation found that dual-task balance training, balance challenge combined with a simultaneous cognitive or sensory task, produced significantly greater improvements in gait stability than single-task balance training alone in older adults. The combination is what makes it work. Here is the routine I want you to follow. Every evening, before you sit down for the night, and I mean every evening, not most evenings, every one, run through this sequence. It takes less than 15 minutes total. Begin with 2 minutes of the cervicothoracic junction mobilization, working C7, T1, and T2 on both sides. Move directly into 90 seconds of the sternocleidomastoid stretch, both sides, finishing with the self-massage at the back of the neck. Then stand up and do 3 minutes of the multi-rhythm coordination, hips, legs, arms, all 3 layers. Then 4 to 5 sets of spotting turns, building speed across the week. Finish with 2 lengths of your hallway and tandem walking with head rotation. That sequence, done every evening, addresses both the mechanical source of the problem and the neurological capacity of the cerebellum at the same time. You are not just managing a symptom. You are treating the actual cause. One more thing I want to say before I close, and it is the most important thing in this entire video. The research on cerebellar neuroplasticity is unambiguous on one point. Consistency is everything. A 2022 review in Age and Aging examined balance intervention studies across adults 60 and older and found that programs performed fewer than 4 times per week produced significantly smaller functional gains than daily programs. The cerebellum adapts to demand. Inconsistent demand produces inconsistent adaptation. You cannot do this 3 times, feel slightly better, and stop. The improvement you are capable of is real and it is substantial, but it requires you to show up for it every single day. I have been doing this work for 18 years. I have watched patients in their early 70s rebuild coordination they were convinced was gone permanently. I have watched people return to hiking, to gardening on uneven ground, to dancing at their grandchildren's weddings, not because they found some extraordinary medical intervention, but because someone finally explained to them what was actually wrong and gave them the correct tools to fix it. You are not too old for this. Your cerebellum is not too far gone. The neuroplasticity is there, waiting for the right signal. You just watched this video. That is the signal. Now act on it. If this reached you, if something in the last several minutes changed the way you understand what is happening in your body, share this with someone you care about who needs to hear it. Leave a comment below with your age and where you are watching from. Subscribe if you want to keep receiving information that is actually grounded in evidence and aimed at your real situation. And I will see you in the next one.